Hello, everyone. Once again, welcome to another episode of DiviCura's interviews. My name is Mathew. I'm one of the Foundation Year 1 doctors here under the County of Durham and Darlington NHS Foundation Trust. And here we have with us our co-host, Dr. Arun Nair, who is a pediatrics resident in the US. And today we're introducing and interviewing a very distinguished personality, Dr. Umair Khan, who is currently an ST1 under the Northeast Deanery. Welcome, Umair, to our show. Thank you very much for joining us.
Okay, it's nice being here. Thanks for inviting me.
No worries, our pleasure. So we just prepared a few questions, and we're just gonna ask you them, and then if you have any questions as viewers, kindly do let us know in the comment section, and or you can give Dr. Umair a shout later on as well. So our first question for you, Dr. Umair, is I know I've introduced you, but could you tell us a bit more about yourself?
So like you said, my name is Umair, and I'm actually a trauma and orthopedics ST1 in the Northeast Deanery, which is the Newcastle area in the north of England. I went to university in Manchester and did my foundation training. So like yourself, I did my F1 and F2 in the Northwest Deanery. But I had a bit of a sort of different pathway in the sense that I did a CT1 year, which is a core training year that you tend to do normally in Manchester before applying for the run-through orthopedics that I'm doing right now. So it's a bit different to your usual training pathway.
Right, okay. Well, thank you for that. Dr. Arun, would you like to ask any questions?
Yeah, absolutely. So a majority of our viewers are medical students and recent graduates as well, looking for applying into either foundation programs or to residency programs elsewhere as well. So what did you, if you could share with us, what did you do during medical school to sort of help plan and sort of map out your future surgical career that you foresaw?
Yeah, so the first thing I'm going to say is make sure you actually enjoy medical school. Because I think once you start sort of like, putting your head down, sorting out your portfolio, career trajectory, it can be quite easy to get quite tunneled and actually not enjoy the journey itself. So the first thing I would usually say is, just make sure you enjoy your first couple of years in medical school. I know nowadays people, start building, their pathway for the career that they want in the first year of med school. But I think we've got to keep an open mind as well at times. What I did specifically was I actually knew that I wanted to do surgery from the third year of medical school. So what I naturally did was, I found a supervisor who was a good mentor. And I think that's quite key, especially in surgery. It's more of an apprenticeship model compared to your medical specialties. So you do need to find someone who's going to be guiding you towards, what sort of things get you points. Because ultimately, the way the UK system works, you get points for doing things, and you've got to be quite selective in what you do. So you can't spend all your energy doing, things that are not going to be meaningful. The other things that I sort of did was when I was in third year, I attended a lot of medical school conferences and lectures, and they tend to give you a bit of an insight into what you need to do to get into surgery. And so at that point, I did meet a couple of sort of senior trainees and surgical trainees as well. And the first thing that they told me was get a self-assessment for your portfolio. And that's one thing in sort of the UK surgical recruitment process that you can influence before actually going into the interview itself. And so, I just worked my way through the self-assessment on my weak points mainly.
Right. Absolutely. I think that's a fantastic, absolutely. That's a fantastic thing that you said in terms of enjoying medical school and not getting too streamlined on one particular aspect of the journey. And also finding a great mentor is such good advice as well, because it's easy to get lost in this journey as well. So to have like someone guide you through the process would be really beneficial. So I understand that one of the processes of mapping out your future career, and one of the components of that is research as well. So do you have any tips for medical students or recent graduates in terms of how they got involved in research, and how can you find opportunities for research as well?
Yeah, so when it comes to research and doing projects and doing audits, you'll find a lot of people will say that you have to work in the best hospitals out there. But actually, that's not true at all. So earlier on, when I said that I did my foundation training in the Northwest, actually, you could probably say it actually wasn't in the Northwest because it was in the Isle of Man, which is a small island between the UK and Ireland. And so, naturally you'd think, oh, you're working in such a small place, probably one of the smallest DGH hospitals in the UK, and you won't have any research opportunities or audit opportunities. Actually, if you're quite smart with your time and you're quite targeted with what you need to do, you can do things. So what I did when I was doing my foundation training there, actually, naturally, we still have medical students, although it was a small hospital quite far away. And what I did was I just developed a teaching program for those medical students, and developed the program and delivered it whilst they were there. And then essentially, I just made it into a publication material, if that's the correct word. So that's what I did as a foundation trainee. Specifically as a medical student, what I would say is do a bit of everything. So if there's going to, I think as a student, you'll have a lot of opportunities. What you need to identify is when to say no to things. So often as a third year student, you're quite naive and you know that you need to do things to get on, to improve your portfolio. And so what a lot of senior trainees can do quite mischievously, I suppose, is they'll ask you to collect data for their project. But you've got to stand back and actually ask, what am I actually getting out of collecting data for this person's project? Am I getting anything out of it at the end of it? Am I getting any poster presentations? Am I getting any publications? Because ultimately, that's what you're marked on when you're applying for surgery. And so you don't want to be wasting, important time and valuable time for you as a student as well, just doing unnecessary things. So again, it comes back to finding a mentor that will guide you into doing the correct things that are quite efficient and that you will get the most out of. I think you have to find a mentor that will guide you through all this.
Absolutely. Now, I did have a follow-up question to the research. Now, obviously, it makes logical sense that when you're doing research, you'd want to do it in the specialty that you're interested in to demonstrate an interest in that specialty. I mean, that sequence does make sense, but sometimes students do find opportunities in other areas or other specialties for research. And do you feel that it's still beneficial for them to obtain that experience and still mention that in their portfolio, that, for example, if they're looking for surgery, they found a piece of research in internal medicine, but they still, they obtained experience in this. So would you think that's still beneficial, or should they stick to just surgical research?
No, absolutely. It's not about what you're doing. It's more about the skills that you're acquiring through the process. So I think the beauty of the UK surgical recruitment process is that it's quite general, and it doesn't specify that like when I was applying for orthopedics, they never specify that actually all your research or your projects have to be in orthopedics. The only thing that they then specify, or they are sort of moving towards, is doing most of your projects in surgery itself, and try and avoiding doing medical projects and claiming points on those. But ultimately, it doesn't have to be in the surgical specialty that you want to do it in as well. So, in my case, if I want to do orthopedics, actually, I can do a project in plastic surgery, or I can do a project in neurosurgery, and it's the skills that I acquire from those that I can talk about. And ultimately, whether you get a poster presentation in whatever specialty, you will still get the same marks that you would do for someone who's only doing things in their specialty. And I'll give you a good example. When I was in medical school, actually, I did, I found opportunities, for doing case reports in genetics. And me being me, I just took all these opportunities on board and I said yes to them, primarily because, I was in a position where I didn't have, those rewards or those publications or those presentations. And so for me, the main thing was, putting my step on the career ladder, putting myself out there and taking those opportunities that are offered. Because what you might find is you might be offered a project in something that you're not particularly interested in, or that is not your specialty, and later on you've said no to that.
Umair, I think we've lost. We can't quite hear you.
Do things. Say yes to things that are relevant for you, and then learn on the job as you're going along.
All right. I think just in between, we did lose a few seconds of audio where we didn't hear you, but that's all right. I'll just follow up with the next question. So the next question is, during medical school, did you do any courses or anything that would help you develop your surgical skills, like be it suturing or anything of that sort during medical school?
Yeah, so I think the first thing I would say is you actually don't need to attend any courses. Being in medical school, you're going to be going on surgical placements. That's the first thing. And so naturally, you've got the time, you've got people there that can actually help you and develop your skills. You do need to go to courses eventually, but that shouldn't be the first port of call. The first thing that you should be doing is, asking your senior surgical trainees, can you teach me how to tie a knot? Can you teach me how to do an intraoperative suture? And actually, you know what? Because of the lack of surgical teaching in the medical curriculum, as trainees, as surgical trainees, we actually love it when students ask us to teach them something, because we know, having gone through the whole same medical school process, we know that actually you don't get much of this teaching in medical school. So, when you ask us, we're more than happy to teach you. And ultimately, you do have to go to courses, but that's because, these are things that you're judged on. So as part of the recruitment process, again, it comes down to, have you been to a formal surgical skills course, such as the basic surgical skills or ATLS, for example, but they shouldn't be your first port of call.
All right, thank you. And during foundation training, or right before you started foundation training, were there certain things that you had planned to help you kind of fulfill your portfolio requirements? Like in terms of, did you follow a specific timeline in terms of the courses you did, in terms of other requirements you need to meet for the portfolio, or did you just kind of figure out things during the foundation training?
So what I would say is, a lot of people that apply for surgery actually only know that they want to do surgery when they apply for foundation training or halfway through it. So in my case, I'm different in the sense that I knew fairly earlier on, so I could tailor my portfolio towards that. So when I did actually start foundation training, the first thing I did was get the self-assessment, because that's the thing that you're judged on the most prior to getting any interview, and go through your self-assessment, tick all the sections that you've completed and highlight the sections that you haven't done. And then what you have to do is look at how long you've got. So when you start foundation training, which is usually in August, you've only really got about, I'd say, just over a year before you apply for surgery. That's assuming that you're going straight into training. So in that year, you then have to prioritize what things you can actually get done quickly. So for argument's sake, if you haven't got an audit and you haven't got a publication or a poster presentation, the first thing I would do if I was in, as an F1, brand new F1 right now, first thing I would do is, crack on and work on an audit, because I know from experience and from having spoken to people, publications take more than a year. And even, poster presentations can take quite some time. And with poster presentation, what you might find is the conference that you want to present on or in is, is not available to you or aren't open for submissions until another couple of months. So the thing that I tell trainees is go for the low-hanging fruits. So like audits, teaching, these are things that you can do quite quickly, as opposed to the long projects that can take quite some time.
Right. That makes perfect sense, actually. So, just two things from what you had mentioned. In terms of the courses that you do, again, I'll go back to the courses. Any specific courses that you plan to do during foundation training, or you recommend surgical and people who want to apply for surgical training do during the surgical training? Sorry, during the foundation training.
Yeah, so if you're a medical student, I'll touch on the foundation training part as well.
Yeah.
But if you're a medical student, what you find that most courses are actually quite cheap for you. So what I would do is I would go on the Royal College of Surgeons website and look at the different courses out there. And there's some that are specifically for students. And what you'll find is it probably costs about £50 to £100, which is actually quite cheap when you compare it to the basic surgical skills and ATLS courses, which are north of £500. So it's quite a difference. So if you are a medical student, the first thing I would do if I was in your position right now is go on the Royal College website and have a look at all the courses out there that are for students. Usually they're quite cheap, and often what you might find is there might be some bursaries out there as well, and your medical school will often have a small pot of money as well to fund one or two courses for you throughout the year, or throughout the 5 years, sorry. If you're an F1, I would say try to avoid going to courses straight away. Now, there's a reason why I say that. It's not to put you off. It's more because when you actually get into surgical training, core surgical training, the courses are actually paid for you, because they're a mandatory requirement in order to progress into higher specialty training. It's a mandatory, these courses are mandatory, and anything that is mandatory for your training, the Deanery will have to pay for it. So basic surgical skills, ATLS, care of a critically ill surgical patient, these courses can cost about £2,000 in total, and the 3 of them. But if you are a core surgical training, they are paid for. Whereas if you're an F1 or an FT, you have to pay out of your own pocket, which is a lot of money for an F1. If you think about it. The other thing I would say is if you think that you've done everything else as part of your portfolio, and the only thing that you need to improve on is the courses, and by all means go and pay for it. But they're not the first thing that I would do personally. I would, like I said earlier on, I would make sure that I've got the cheap things first, like audits, teaching, leadership roles. These are things that don't require a lot of money. They just require a bit of investment from yourself in terms of time and getting things done.
That's actually a very good advice, because a lot of what you've said right now are things that I'm somebody who's planning to apply for core surgical training at the end of this year. So I didn't quite know these things whilst I was doing foundation training. So I was in the mindset of probably doing these courses as well. But if you actually do have a look, there are a lot of other courses like Umair had mentioned that are on the cheaper side. And if it's just about meeting the requirements, you might as well can do them, and you would still get the full set of points. And you don't really have to do these specialized courses, right? And do you have a question, Dr. Arun?
Yeah, absolutely. Just to sort of bring it back to the origins, where did your passion for surgery and for orthopedics come from? Well, what was the sort of turning point?
Yeah, so funnily enough, when I applied for medical school, I actually wanted to do pediatrics. So
you could have joined the team.
Exactly.
I'm just saying.
Yeah, people always get quite surprised when I say, "Oh, I wanted to do pediatrics," and somehow I've ended up in orthopedics, because there's this old stereotype of orthopedics being, the specialty that you only get the people who are not friendly that go into it, whereas pediatrics is the complete opposite. But yeah, like for myself, I think so in Manchester, the way the curriculum is, the first 2 years is preclinical, and then the next 3 years are clinical. And so my first placement in third year was a surgical placement. It was actually renal transplant, which is not the specialty that I wanted to do, but actually seeing being in that surgical environment, being in theatre, that buzz of being there, making a difference. Especially with transplant, you're making a huge difference to patients' lives. So that's what really sparked my interest in surgery. And then going beyond that, I had a orthopedic placement, and I had a mentor who he actually treats athletes, but he was very humble in the way he presented himself, the way he taught students, and the fact that actually he took time to mentor me, guide me, and actually tell me what to do to get the best out of my time in medical school. And I think that's quite important, going back to having that important person as a mentor. And really, that's what sparked my interest in surgery, and specifically orthopedics. And the other thing with orthopedics is, I think, depending on what you are as a person, medicine can mean different things for different people. And so for me, in the long term as well, orthopedics offers that work-life balance that I'm looking for. So that's really my reasons for doing orthopedics and surgery.
That's amazing. That's a very interesting take on this, and absolutely these stereotypes. With regards to how surgery is, I don't think that's true at all, just because it's not that orthopedics is unfriendly at all. I mean, the work you guys do is incredible with regards to, how precise, how careful you have to be with every step that you do in your surgical management. And even with the non-surgical management, knowing when to do surgery and when to go with either medical or conservative management, that is so important, right?
Well, exactly, yeah.
And to be able to communicate that with patients, to be able to understand that you have to be a friendly person. So I feel that stereotype is very misrepresented in the field of surgery, especially orthopedics.
Exactly. I think, gone are the days where, surgeons are not friendly anymore, because what you find is with the new cohort of trainees coming through as consultants, you'll find that actually they're willing to teach you, they're willing to acknowledge that there's a junior in the team that needs to be trained, because actually these juniors are the very colleagues that will be treating them when they're old. So you've got to train them, you've got to invest time in them. And although I'm in ST1, when I have F1s and F2s with me, I try and teach them as much as I can, whether that's in an A&E setting or whether that's in theatres, getting them to do a bit of suturing. So yeah, you've got to show that willingness and make them feel as though they're part of the team, which is quite important, I think.
Absolutely, because I've noticed, and I don't think this is true with, it's not just surgery per se, it's every specialty where if a student wants to learn, they have to take the initiative. It's not that, because residents and attendings, they have so much on their plate. It's not that they can always constantly offer opportunities. It has to be initiative from the student side to learn. And that's how they will be better, right? I mean, absolutely. I mean, I really hope we get that message across in the sense that surgeons are not, mean people. They're actually very nice, very caring people.
Very, very nice people. We love having students around. We love teaching. And, with orthopedics, you have the best tools out there as well. Who wouldn't want a drill or a hammer? It's amazing.
I mean, I think it's going to more so change in the coming years. So, people are always going to hear things, but when you experience things, I think it's like the word of mouth will go around saying that things are different. Like me personally, I'm an F1 trainee, but I can tell you for a fact all the surgeons I work with are amazing people, amazing personalities, really keen to teach. So I can't quite relate with the fact when people say surgical consultants are rude or they don't want to teach, because I think the surgeons I'm seeing, like Umair mentioned, are the new cohort of surgeons who are becoming trainees becoming consultants. Yeah. So that's really interesting. And
absolutely. And I'm just saying, Dr. Umair, if you ever want to join back to the pediatric side, we always have room for one more. So, you know, if you ever change your mind.
Well, maybe we can subspecialize into like pediatrics, orthopedic surgery or something, you know.
Yeah, I think there's some specialty called pediatric orthopedics.
Yeah, so you never know.
I'm just saying pediatrics is always open.
Yeah. Interesting. Umair, just a quirky question, actually. Have you come across scenarios where, you know, surgery is something that's really, we know it's it's a very competitive specialty to kind of match into. Where have you come across scenarios where people kind of told you off, or, you know, you felt like, you know, they didn't believe in you, or, you know, that sort of thing? Have you come across scenarios, or do you want to share any stories that you have, any interesting stories?
Yeah, absolutely. I think it's not just medicine or, you know, surgery itself. My first experience of someone telling me that, you know, I can't do something was back in when I was in sixth form college. Actually, one of my teachers said, actually, I don't think you'll get into medical school, or I don't think you'll get the grades, which isn't what you want to hear as a student, you know. But what you find is, me as a person, I find that as a driver, as a motivator to push on and prove this person wrong. But I suppose that's one, you know, personality trait that surgeons tend to have. You know, they don't want others to doubt them. So the thing that, you know, pushes them forward is these doubts from people that they have. Specifically, when you know, surgery is a specialty where you will hear a lot of people say that you're not good enough. You will hear a lot of people say that. But what you have to do is you have to just prove them wrong. You know, put your head down, work hard. I say work hard, but work smart at the same time. And really, you've just got to drown all these voices out as though, you know, they're talking to you, but, you know, it goes through one ear, comes back through the other ear, and really just get on with it. People will have opinions, and that's not just surgery, that's medicine, you know, pediatrics as well. People will have opinions, and they will always say, actually, you know what, you don't fit into our specialty. You know, the number of times I've heard people tell me you're too nice, which I never thought was a problem. But apparently being too nice is a problem when you're in surgery. What you've got to do is round all these comments out, because they want you to fit a certain stereotype. Yeah, but you don't have to fit that stereotype to be, you know, a nasty person, to be someone who's not likable, to be a surgeon. That's not how it should be. It should be, you know, you're a nice person, you're approachable, you're willing to teach, and that should be enough for you to do surgery. So again, it comes down to just, you know, drowning all these voices out, making sure, yeah, you're going to hear them, but try not to let them affect you too much. And, you know, if you ever find that someone says something that is out of line, you've got to, you know, report it to someone, because there's a limit that people cannot cross, and they shouldn't.
Absolutely. I think this is also the perfect opportunity to kind of give a shout out to Dr. Umair Khan's Instagram, the bone surgeon. So basically, so why I personally wanted to interview Dr. Umair Khan was, I did a locum in trauma and orthopedics in Darlington, and I've seen Umair before, but I haven't really talked to him. So when I started, I think we had quite a generous shift in which, you know, we weren't too busy, so we had a good conversation. I realized Umair is such an inspirational personality, you know, because I'm personally somebody who wants to get into surgery, and I always think of it as something that's very challenging. But then, so the one thing that really struck me was that Umair is trying to get the message across that anybody can do surgery, anybody can get into surgery. It's all about just working, you know, smart as opposed to working hard. So please kindly do follow his Instagram, and he shares stories, tips, videos, and things like that as well. So that's it. And do you have any last words of inspiration or wisdom for our viewers and, you know, medical students, surgical aspirants?
Yeah, so I think you touched upon it there. You know, work smart, not hard. You know, don't get me wrong, there are opportunities in life, you know, as part of your training where you will have to work hard, you know, to acquire new knowledge. But when it actually comes to applying for a job specifically, you have to be smart with how you use your time. You know, we're all human beings. Medicine is not just our life. It may be for some people, not for me. You know, I have other commitments. I've got family, friends. I've got, you know, things that I like to do outside of medicine, and I want to be able to do all those. And you know, that they all require time in the day. You've only got 24 hours in a day. And so you don't want to naturally be, you know, spending half the time just doing medical related things for your portfolio or for the recruitment process. So what you have to identify is, how can you work smart in, you know, a short amount of time to get the most out of it. So anyone that I meet, especially when I met Keith, the first thing I told him was, you know, make sure you work smart, you know, and that might mean, you know, doing an audit project that might take you a week to collect the data. You know, the following week might be your intervention, and in the third week you can re-audit. You know, within 3 weeks you've got a complete audit cycle. Whereas, you know, you might find some people, they'll take a year to collect the data. Yeah, you might get a lot of meaningful results, but that meaningful results, unfortunately, isn't going to help you in terms of getting a job So you've got to, you've got to be quite specific. You've got to work smart when you're applying for a job, unfortunately, and that's the nature of the recruitment process. I always tell students that the large, the fruitful, the meaningful results is really going to be your downfall, because ultimately you get judged on the objective parts of the portfolio, which is what actually have you done, not what you are going to do.
Yeah, splendid. Actually, it touched my. So it basically set a lot of things straight in my mind, and I've been working a lot differently since then. That's only been like 2 weeks, so that's wonderful stuff, really. So thank you very much again, Umair, for joining us. And guys, if you do have any questions, again, please do follow Dr. Umair's channel, Instagram account. And if you have any questions, please do share it in the comment section, or you can give him a shout out as well. And that's it. Really hope you enjoyed very first pilot or starting interview for a series of interviews to come. And if you have any personalities you'd like us to interview, again, do let us know. And thank you.
And what a way to start.
Yeah, what a grand way to start. I'm
Absolutely.
so thrilled and
And Dr.
excited.
Umair, honestly, like talking to you, having someone who's young, who's energetic, who's fresh, who understands the plight of medical students and graduates. I mean, it's so meaningful, and we're so grateful that you gave us your time, your energy, and your experience to, so that we're able to, through our channel, we're able to help prospective surgeons as well. So honestly, we both, thank you from the both of us for helping us.
It was my pleasure being here, and I think it's quite important that as junior trainees that we guide our juniors as well.
Absolutely.
You might find that senior person that just pulls up the ladder as soon as they reach the peak of their career. Don't be that person, is all I'm going to say to people. Always remember that you were once a student that found it difficult, so you have to understand that your students are going to find that difficult as well, which is what you had.
Absolutely.
All right, guys, thank you very much, and we are signing out.
And Dr. Umair, we have a request for you.
Go
So
ahead.
we have a signature sign off here at DiviCura's, and it's from our native language. So we're wondering if you're comfortable with it. Would you like to give it a try?
I'll try. Yeah, give it a go.
All right, absolutely. So we usually start like this. All right, and we go Nandi,
Namaskaram,
Namaskaram.
Namaskaram,
and Pakalam.
Pakalam.
There you go.